Did you know that more than 70% of stomach cancer patients are only diagnosed when they have missed the early stages? When the symptoms are obvious, treatment becomes difficult and less effective. Meanwhile, if detected early, the 5-year survival rate can be up to 98%. Mr. Lamb, 61 years old, was originally a healthy person with normal health. However, in a short time, he often felt full, had a loss of appetite and lost weight rapidly. Thinking it was due to stress or gastritis, he was subjective. When he went to the hospital, he was diagnosed with stage 3B stomach cancer. The treatment prognosis became very limited. Stomach cancer is the abnormal growth of cells in the stomach lining, forming malignant tumors. When the tumor spreads, it can invade the liver, pancreas, lungs or lymph nodes. Early symptoms often overlooked: fullness, heartburn, nausea, loss of appetite, vague pain in the epigastric region, feeling of choking, difficulty eating, unexplained weight loss, anemia, pallor, gastrointestinal bleeding, vomiting blood, black stools, late symptoms, severe pain after meals or when hungry, persistent nausea, reflux, digestive disorders, constipation, diarrhea, loss of ability to absorb nutrients. Solutions and prevention: regular screening, gastroscopy at least once a year if you are at risk of ulcers, Helicobacter pylori infection, family history, reasonable diet to prevent, avoid pickled foods, smoked foods, fried foods with a lot of fat, limit alcohol, coffee, tobacco, increase green vegetables, fiber, vitamins A, C, E, healthy lifestyle, get enough sleep, reduce stress, exercise, be proactive with your body. When there are unusual signs, do not be subjective. Go to the doctor early to get an accurate examination and test. Reminder at the end of the video: stomach cancer is not a death sentence for those who know how to listen to their body and act early. Please share this video with your loved ones and don't forget to subscribe to the Senior Health Rise channel to receive more useful videos regularly.